Okay, this video is breast cancer awareness overrated? And that's the key word, awareness. You're always going to hear awareness, breast cancer awareness, prostate cancer awareness. By the way, breast cancer and prostate cancer are kind of the same thing. They're both hormonally sensitive to estrogen, so breast cancer in women, prostate cancer in men. So this goes for men too. Is prostate cancer awareness overrated? So, the idea of awareness is a good thing. Sure, I'll grant that. But what I'm trying to say is, people run around with the pink ribbon. Oh, we're raising money for breast cancer. We're raising money for breast cancer. So happy. They feel they're doing something good. And what I'm trying to say is the emphasis is on get a mammogram, turn yourself into a patient. In my entire life, I've never personally met a single female who was conversant with me about estrogen chemistry. I'm sure I've met some OB-GYNs who know a lot about it, but they never once spoke about it with me. And I think this should be a routine conversation. I mean, what could be more important for a woman than to know about how to minimize the risk of cancer? And it's so easy to do. There's few things in life easier to do than to minimize your exposure to estrogenic chemicals. And that's how you help prevent cancer. So what I'm saying is all these women are programmed, I got to get a mammogram. Okay, and the value of mammograms is also quite overrated. If you actually study them, and especially in premenopausal women, they got the dense breast. Okay, it's real hard to see a cancer in a dense breast. Now, there's all kinds of special circumstances. I'm fully aware of that. I rotated through mammography. And anyways, so what can we know about this that's useful? And there is a lady by the name of Philippa Darby, PhD chemist in England, who wrote a fantastic book about the chemistry, estrogenic chemistry. Estrogeneration by Dr. Anthony J. is probably the best introduction to estrogen chemistry. Okay. All right. So for any disease, you want to learn what causes it and then avoid the causes. That's how you avoid a disease. And for women, to reduce the risk of breast cancer, they need to know how to recognize an estrogenic chemical and then how to avoid it. So first of all, these are real easy. I made much more extensive lectures on estrogen chemistry and the details of all the subtypes and whatnot. And I call that one lecture Female Problems. Right here, I'm just going to quickly hit the key points. Don't eat meat or processed food, because there's two types of gut flora. There's gut flora from plant foods that has a lot of fiber and creates the good gut bacteria. That's what you want. The gut bacteria from processed food and meat is about the same. And the reason is it lacks fiber. And the lack of fiber leads to pathogenic bacteria that will deconjugate the liver excreted estrogens. Normally our liver excretes estrogens into the bile, which then go out, we defecate them out of our body, and that keeps estrogen levels low, which is what you want. But the bad bacteria will deconjugate the liver excreted estrogens. Typically they're conjugated with something called glucuronic acid. Glucuronic acid is really just a glucose with a carboxylic acid on it, essentially. And once they're deconjugated by the bad bacteria, the estrogens are reabsorbed into the blood. So women who eat a lot of meat and processed food have significantly higher levels of estrogen. The meat and the dairy often intrinsically will contain a lot of estrogens. Meat, animals, chickens and whatnot, they're given estrogens because it makes them grow faster. Estrogenic chemicals in high amounts make an animal get fat. Dairy often contains lots of estrogens because the cows are now genetically designed to make milk while they're pregnant. And that also predisposes, kids going into premature puberty. All right, you want to stay skinny. Well, when you eat less processed food and less meat, no processed food and no meat, you'll tend to be skinny in a good way. Being fat tissue, adipose tissue it's called, has more of the enzyme aromatase, which makes more estrogen, raises estrogen levels. So a typical American is a fat meat eater. That's why they got high estrogen levels. That's partly why they're sort of wimpified, sissified. That's also why they're prone to gynecomastia, and they're prone to increased prostate cancer, and they're prone to increased breast cancer. Sort of the main thing that'll make a woman die prematurely. Like when I talk to medical students and residents, I say, you want to save your mother's life? Most likely thing to cause her to die prematurely is cancer, especially breast cancer. And for men, I teach them about coronary artery disease, because the most common reason their father is going to die prematurely is from coronary artery disease. Anyways, good to get a whole house carbon filter, because it'll remove carbon compounds like the estrogenic chemicals. There's tons of estrogenic stuff in your water. Ethinyl estradiol, EE2, from birth control pills. That gets in the water. It's too expensive for municipal filtration to remove all these estrogenics, so they don't remove them. You'd be amazed, if you study water, how much estrogenic chemicals are in tap water. Atrazine, the non-organic herbicide. That's the one that turns male frogs into female frogs. Aluminum is a metalloestrogen. They'll put aluminum into the water because it makes it look clear, but it's a metalloestrogen. They put put that into the water intentionally. And it is associated with Alzheimer's disease. I wouldn't use the word Alzheimer's disease. Let's say dementia. It has an association with that. Higher levels of aluminum in the water have higher levels of cognitive impairment. And there's carbon filters, and there's sort of intermediate filters, a so-called Berkey filter, and there is other variations on filter. Reverse osmosis is a more powerful filter. Distillation is a more powerful filter. What I actually do is I have a whole house carbon filter, and I have a kitchen reverse osmosis filter, and I'm happy with that. Eat organic to avoid estrogenic herbicides like atrazine. We talked about that. No deodorant. Okay, deodorant to me is like one of the stupidest things, okay? And it just shows how stupid people are that they routinely wear deodorant. I mean, basically, you're just taught, oh, you got to wear deodorant, you don't want to stink. You know what? Never in my life have I heard of a man who said he would turn down a woman because she smelled bad. Never in my life have I, when I say hello to a person, I say, hey, how you doing? I don't walk up and smell their armpit. It's just conformist stupidity to wear deodorant, okay? And then what does a typical person do? They shave their armpit first to increase transdermal absorption, so then the aluminum with the shared lymphatics between the breast, the upper outer quadrant, and the axilla, the armpit, exposes the breast tissue to that metalloestrogen, causing proliferation of breast ductal cells. In addition, the preservatives are typically parabenzoic acids. They're called parabens, and they could be other estrogenic preservatives as well. We talked about that in my lecture on female problems, how the estrogenic chemistry, it's like the perfect preservative, long shelf life, and it's antimicrobial, so no mold grows in all these cosmetic products. Minimize other cosmetics. Most shampoos, perfumes, moisturizers, sunscreens, they're all estrogenic. I don't even use dishwasher soap. If you don't cook with oil, you don't need dishwasher. I don't put laundry detergent on my clothes. You know, if it's got like 3 estrogens in it. The container is a BPA plastic container. The liquid, typically also the plastic container will have phthalates, or plastic conditioners, 2 estrogens. The detergent itself will be estrogenic, and then the little softeners in the dryer to help minimize wrinkles, those are estrogenic. So you can get 4 estrogens on your clothing that touch your skin all day and are transdermally absorbed if you use that crap. I don't use any of it. You don't need it. I got a separate lecture on minimalism if you're curious about it. Save money, make your life simple. It's good to be simple. Most of the highest achievers I've ever met in my life, world champion athletes, for example, they're real simple, so they can put all their energy and focus on achieving in their area of interest, their sport, for example, or a scholar. They can put their focus on achieving in their area, versus a person who tries to be normal and fit in and be kind of stupid like everyone else. They waste tons of time and money with all this peripheral activity that doesn't get them anything. So the important point of this whole talk was focus on understanding estrogenics and avoiding them. That'll dramatically minimize your risk of breast cancer. Whether or not you want to get into a mammogram, that's a whole other topic depending on what your risks, your age, and all that are, and we're not going to talk about that today. Anyways, I hope this was a good reminder about learn estrogenics.